Buoy Health Insights, Limping. Welcome to another episode of Buoy Health Insights, where we explore health topics and provide you with a deep dive into symptoms, causes, and treatments based on the latest medical research. If you're here because you or someone you know is experiencing limping, you're in the right place. Don't forget to like and subscribe for more health insights. Limping isn't just about avoiding weight on an injured leg or foot. It's a complex issue involving the nervous system, including the brain, spinal cord, and the nerves that supply muscles, as well as the musculoskeletal system. If you're limping, you might also be dealing with pain in the foot or leg, hip pain, and a range of other symptoms like weakness or numbness in the legs or feet, difficulty standing from a seated position, shooting pain down the backs of your legs, frequent falls, a feeling of imbalance, or an inability to flex your toes. These additional symptoms give us clues about the underlying causes of your limping. The most common causes of limping are injury-related, including trauma, overuse injuries, or even pain to the hip. This makes sense, right? You're trying to avoid the pain by putting less weight on the hurt area, resulting in that limp. But limping can also be an indicator of more complex conditions like neuromuscular disorders or issues in the nervous system. For instance, genetic conditions like muscular dystrophies, spinal cord compression due to injury or age-related diseases, and even infectious or inflammatory conditions can affect muscle strength, leading to a limp. Now, if you're dealing with something like posterior tibialis tendinopathy, where a key stabilizing tendon in your foot is injured, you'll feel pain that worsens with activity, and notice that your foot's arch may collapse when you stand. It usually happens due to high-impact sports, but can also be related to overuse. Treatment for this might include rest, pain relievers, orthotics, like shoe pads, braces, or even steroid injections into the tendon. Surgery can be considered, but it's complex. There's also a condition called iliopsoas bursitis, where the inflammation is in the bursa of the hip, which is a small fluid-filled sac that helps reduce friction. This type of bursitis causes pain at the hip joint and can radiate to the outside of the thigh. To manage iliopsoas bursitis, you typically avoid aggravating activities, take over-the-counter pain medication, undergo physical therapy, and sometimes receive steroid injections. Surgery is a last resort and is rarely required. Now let's talk about when you should seek medical care. If your limp is getting worse or sticking around, it's time to see your doctor. You might need crutches to take the weight off an acute injury, or physical therapy may benefit you if the cause of your limp is related to an orthopedic injury or muscular weakness. A full neurologic assessment will be necessary, especially if it's believed that the brain, spinal cord, or nerves are involved. This involves testing your strength, sensation, cognitive ability, and walking capabilities. If an inherited condition is suspected, your doctor might suggest genetic testing alongside imaging like a CT scan or MRI of your brain and/or spinal cord. In summary, limping can be more than just an injury. It could point toward broader health issues. Paying attention to your body's signals, like accompanying symptoms, is critical to understanding and addressing the root cause of a limp. Remember, we're here to keep you informed and in charge of your health. Hit like, subscribe, and comment below with any questions or future topics you'd like us to cover. Until next time, stay healthy and stay informed.